Hi, this is Jessica Salles, and I'll be presenting on best practices to reduce stress and burnout in oncology nurses. Abstract. The clinical practice problem evidence-based paper researched the best evidence-based practice to reduce stress and burnout in oncology nurses. Peer-reviewed articles related to stress, burnout, and compassion fatigue for oncology nurses were used. These articles, no older than 5 years old, came from a variety of oncology nurses in North America. Stress, burnout, and compassion fatigue were common trends. Oncology nurses experience burnout related to emotional exhaustion, stress related to workload, and patient death and dying. The effective methods that were found to positively impact coping were collaborative and teamwork, verbalizing, exercising, taking time for self, and implementation of educational programs. In Emory College BSN program, Student Learning Outcome, nurses hold the responsibility of providing patient-centered care. However, oncology nurses experience many different stressful work factors that can lead to physical, mental, and psychological health problems, and that can hinder their patient care and the nurse-patient relationship. Positive coping strategies and educational programs were found to improve the overall health of the oncology nurses, which in turn provided better patient-centered care. Significance to nursing practice. A descriptional cross-sectional study was used to identify the most stressful factors related to oncology nurses. The sample size was 40 oncology nurses working in 4 outpatient units who completed the nursing stress scale. So this included 3 open-ended questions and a demographic questionnaire. The study showed that the highest sources of stress were workload and patient death and dying. So these findings suggest a greater risk to lower work performance and care. Physical and emotional demands of the patient-nurse relationship. Stress can negatively affect oncology nurses' physical and emotional health, which could lead to compassion fatigue. And nurses hold a higher responsibility in oncology nursing. They provide care for critically ill patients, specialized care. They're exposed to high levels of stress and a lot of responsibilities. As mentioned on the previous slide, stress in oncology nurses can lead to compassion fatigue, and compassion fatigue could lead to increased occupational hazards related to tiredness and anxiety, failing to observe the patient's deteriorating condition, reducing the quality of care, and failure to ensure patient safety. It could also lead to decrease in empathy. This is the approaches taken to respond to the clinical practice problem. The majority of the article's research suggested that nurses need to be provided with education surrounding the importance of teamwork and collaboration and how working together can benefit themselves and their patient. Also, nurses should be utilizing positive coping strategies and workplace educational programs. Positive and negative coping skills. In a survey study, teamwork and collaboration were shown to provide nurses with greater ability to care for themselves. 51 out of 61 nurses agreed that nurse collaboration and teamwork would decrease burnout. In another studied survey, verbalization, exercising, taking time for self were 3 of the most frequently used coping behaviors to relieve occupational stress. Lastly, participating in educational programs were shown to have a positive outcome in reducing stress and burnout. Negative coping skills include overindulging in alcohol, staying out late at night, which causes sleep deprivation, poor self-care outside of work, keeping feelings internal, holding back the tears, and sadly, eating sugar. This is the best evidence for the data that has been presented on the previous slides on teamwork and collaboration, the most frequently used coping behaviors, and the educational programs and the implementation of these programs and how they are designed to decrease emotional exhaustion among oncology nurses. Implications for nursing practice and future research. Educational programs will allow novice nurses to understand the mental, physical, and psychological toll working with cancer patients can bring. Nurses should be aware of the grief and loss that may come with the job, as well as effective and ineffective ways to cope with stress and burnout. For oncology nurses to successfully adopt changes in collaboration and teamwork, the institution should implement meetings that express the benefits in working together as a team. Nursing administration should also take into account patient-to-nurse ratio, assignment workload, and the emotional aspect that oncology nurses go through when they care for these dying patients. For further research, there should be more interventions for best practices to reduce stress and burnout. Although there were questionnaires and surveys on best practices, and implementation of educational and exercise programs would provide a stronger best evidence nursing practice, as well as larger sample sizes that would aid in determining the best evidence for reducing stress and burnout. And these are my references. Thank you so much for listening.